Why is it important to study public health? Studying public health is important because it focuses on protecting and improving the health of populations rather than individuals. Here are some key reasons why public health study is essential. Number one, for disease prevention and health promotion. Public health identifies health risks and works to prevent diseases before they happen. And this includes vaccination programs, hygiene and sanitation campaigns, education on healthy lifestyles, like diet, exercise, avoiding smoking, and so on. Number two, for reducing healthcare costs. Preventing diseases is more cost-effective than treating them. By reducing the number of people who get sick, public health efforts lower the burden on healthcare systems and reduce medical expenses. Number three, for responding to health emergencies. Public health professionals manage outbreaks like COVID-19, Ebola, etc. And that by tracking the spread of disease, implementing control measures, and coordinating emergency responses. Number four, addressing health inequalities. Public health identifies and addresses factors that cause differences in health outcomes across groups, such as poverty, education level, access to health care. And this promotes social justice and equal opportunity for a healthy life. Number five, for improving quality of life. Public health focuses on long-term well-being, not just the absence of disease. Efforts like mental health support, environmental safety, and workplace health standards contribute to healthier and happier lives. Number six, for protecting future generations. By addressing issues like climate change, pollution, and childhood vaccination, public health ensures a healthier world for future generations.